hyperextend, then it's very painful to go to that injury direction. Same thing. If you fall, you might also fall on the back of your hand, and you fall down that way, and you go into hyperflexion. So the idea is to use the fan technique that we did with elbow hyperextension to prevent that action at the wrist. Obviously, in the elbow, because it's this hinge joint that has an end point, treating for hyperextension is necessary, but obviously treating for hyperflexion is not necessary. So the only difference at the wrist is just thinking about the injury direction. If I had hairy arms, I would put some Pro Wrap on it because I want to make a base up around the muscle belly. But the thing is, it's not ideal. So if I was to do this on a regular basis, I would shave the arm, and you know, sometimes it's just to try it out. Now you're not going to cover or be hairless.
No problem with that?
It's super great for taping. Here's the muscle belly, and I'm not going to go all the way onto the muscle belly, so I'm not using elastic tape, but I am going up pretty high. So the first thing I do is I put on a couple of base strips, just like I did at my elbow, but I'm using 1.5 inch, and I'm changing the angle a little bit, sometimes 2 or 3, depending on the size of the fan, and overlap by half. And it's the idea that I am going to just make an anchor for my fan to go on. Then I'm going to put one on the back of the hand here. Whenever you come through the web space, it's a really good idea to pinch the tape so that it doesn't cut into the web space. And when you come through here, always make sure the fingers are splayed. That means spread out. And I'm going to show you medial to laterals just so that people get the right idea about the habits. So I'm going to come through here. I showed you how I pinched it. Maybe I should leave that then, eh? Flip for me. And you can come in at an angle so that you actually get a good fix on there. Because if you don't get a good fix, then it's hard to anchor this. Now, if this injury was hyperflexion, I want to keep it away from hyperflexion, and I'm going to put a fan on the top surface so I pull it away from that. If it was an injury that was hyperextension, I'm going to put my fan on the inside to keep it from going in that direction. And that's all there is to that tape job. So I measure it. I might over-exaggerate it a little bit like we did with the elbow. I make sure my fan is small enough, and then I come to the table and I create the fan just like I did previously. And make sure that the fan, I know last time people were starting to make nice axes, but they were going so far that it was creating shadows. So make sure that you're ripping it all the same length and that you're not getting shadows or windows for that matter. And usually, again, just like before, that X will fall over the site of the injury, which is right in that joint line in this case. 3 is plenty usually. And if you have a really big forearm, you may find that you need to go 5 just to make it wider so it has a bigger surface area. I'm going to make sure that when I place it down, he's flexed. And make sure it's a nice tight hold. And then I just go right back over top of my original strips to tack it all down. And that's all there is to it. Sometimes athletes would like you to put both flexion and extension directions down. And sometimes they don't. So it really just depends on the injury. You have to interview them, find out what happened. And you don't have to close it all the way down. That's usually all you need. Sometimes an athlete would like to have 2 base strips on here. But the problem is then you're getting into the web space. But as long as you're making it a nice tight fix, then it's not going to come undone.
So that was a flexion injury?
I'm preventing it from going into flexion. That's right. Right? And that's probably as far down as you need to go. That's all that is on that tape job, and that prevents him from going in. And sometimes they put that underneath the glove. Right? You can't go anywhere there. Right? But I have nothing here. He has full extension, but he can't go anywhere into flexion. And if I put the fan on this side, sometimes that's all they want. And sometimes this is used in conjunction with additional tape jobs that we do.
So boxers use it for that?